So I invite the next speaker to the stage, Dr. Alok Modi. He's going to be talking about the topic predictive prevent personalize, AI's role in risk stratification and remote monitoring. Doctor is he's the topper in Institute MT in internal medicine from SG Medical College and Game Hospital, and he's a fellow of American College of Physicians USA. He's an ex-faculty of Shivaji Hospital and Rajiv Gandhi Medical College, awarded APC Internist Award, and he has several awards. He's a council member of American College of Physicians, and he's done a certified American Board of Artificial Intelligence in code and machine learning. So, and he's also a part of many publications. I welcome you, sir, to the program.
Thank you. This is working? Fine. So first of all, many thanks to Jyoti sir, Sunita ma'am. My regards and respect to the respected chair and all the dignitaries of the dais. So my topic is something which is very interesting, because AI now, I think for the last few years we have been talking about AI and there's a lot of theory. So today I'm going to try to bridge that gap and show you what is practicality and real life use of AI supported with evidence. And the topic is very clear. I would be dealing with the prediction capabilities of AI, the preventive capabilities of AI, personalization or precision medicine capacities of AI in two verticals: risk stratification and remote monitoring, with real life examples and examples from India which are really mind blowing. And I'm sure you will enjoy this session, but I'm going to walk through it because it's 15 minutes only. It's a pretty long session. Now the perfect thing is, why do you need AI? In the first place, why are we discussing AI or artificial intelligence? Because we don't see the storm that is coming in. What is this storm? There's a 134% increase in the Indian diabetics. It's a very young age onset Indian diabetics. There's a huge gap in healthcare. The government of India keeps talking, and that is one endo for 1,000 patients. 75% in the rural population are not accessible to the 1-tier and 2-tier cities medicos. Can you bridge that gap with AI? If you see the amount of benefit that AI gives in retinopathy and admission rate reductions, it is phenomenal. So we need to see the three pillars where AI can actually help you. It's now going to be a different kind of way we approach medical care. It's no longer just clinical care. We are looking at, we used to talk about evidence-based medicine. Now we're going to talk about data-based medicine. Data is money and AI deals on data. So predictive capabilities, preventive capabilities, and personalization, something which only AI can do, is precision medicine. Nobody else can do. Let's now walk you through real-life cases. Diabetic retinopathy, an IT professional, 48-year-old guy from Hyderabad, 10 years, type 2, 8.2% HbA1c, very regular with his care, used Google AI and Arvind, picked up microaneurysms in 85% risk threatening, which was not picked up. This tool of Google AI and Arvind has achieved a sensitivity of 97.5, specificity of 93.4, was on regular follow-up with Forrest's Health AI, and AI would give timely screening. Every 6 months picked up non-proliferative retinopathy. Remedios fundus on phone, AI guided him and targeted his therapy and showed real-life results. Now what is this? Let me just show you a very quick example of this.
At Google I/O, we announced Google AI.
Can you get volume from the laptop?
To bring the benefits of AI to everyone.
Yeah, but the coaxial cable is there. This, Amit will agree, we always get this problem in every tech meeting. There is some tech problem and we get a good audience because of that. It's a very auspicious signs for us. Right, Amit? You always get this. But anyway, I'll try again.
Retinal scans, there were things which humans quite didn't know. Last year at Google I/O, we announced Google AI. It's a collection of our teams and efforts to bring the benefits of AI to everyone. Retinal scans, there were things which humans quite didn't know to look for, but our AI systems offered more insights. Your same eye scan turns out holds information with which we can predict the 5-year risk of you having an adverse cardiovascular event. Another area where AI can help, is to actually help doctors predict medical events. Turns out doctors have a lot of difficult decisions to make, and for them, getting advance notice, say 24 to 48 hours before a patient is likely to get very sick, has a tremendous difference in the outcome.
So this gentleman does not need any introduction. He is a person behind Google's AI. It's creating waves in the medical industry, in healthcare.
Last year at Google I/O.
Look at this second case. We are using Apollo Pro Health AI platform for predicting the atherosclerotic cardiovascular disc disease. You're getting a 42% increase in the risk production. You're getting a 23% pickup in silent MI. So you can imagine the kind of benefit it is giving to your patients. It can prevent, and this is being used by Apollo in India. Microsoft Azure is the technology behind it. Microsoft has also recently launched an AI tool which will aid clinicians in a bigger way, and that is specific for India, and it is already creating a huge wave. So this kind of screening detected around 70% LED stenosis through an AI algorithm, which is mind-blowing. And you can personalize it with a Healthify B coach, which comes right on your mobile. And this is a tailored program which can take care of reduction of HbA1c, reduction of weight, and reduction of glycemic profile and scores. Now let me show you what this AI CVD score is of Apollo.
Hello. Welcome to Apollo Hospital's AI-based cardiac vascular disease risk prediction algorithm. AI CVD cardiac risk score is a novel artificial intelligence-based risk score system that provides the individual's risk of having coronary artery disease-related events in these.
So I've just walked you through the video because I've got only 15 minutes. Basically what this does is it just makes you answer some questions, gets you to analyze your patterns, and gives you a predictability which is 97 to 98% high, because it does these algorithms which are going to create the risk calculator, unlike the clinician calculating the risk calculator, which is what we have been doing so far, and the outcomes are again mind-boggling. So it not only does that, it can even tell you the risk, it can personalize the care for your risk factors individually and can help you manage that. Look at hypoglycemia, which is another big thing that we need to be aware of. When you combine a Guardian sensor with a sugar AI assistant, you can predict hypoglycemias. And I think one of the biggest things we've listened to Banshi sir's talk on 780G insulin pumps, the incidence of hypos in type 1 diabetes has reduced drastically because of automatic insulin regulation in a type 1 diabetic, because of the newest pumps which have got an AI technology inbuilt into their algorithms. If you combine this and you combine it with a Driamed Advisor Pro, you can prevent hypos, you can manage hypos, and you can teach the patient how to take care of his hypos in the future. Absolutely mind-boggling. Kidney disease in diabetics and non-diabetic, AKI, picking up AKI when the creatinine is normal, picking up AKI when the patient does not have so-called low EGFR or normal creatinine, picking up AKI when the patient walks into the hospital and the ICU. All this is possible, and this is a 62-year-old actual patient from Kolkata, type 2 diabetes for 15 years, hypertension, EGFR of 72 with a micral positive. Clarity's tool can pick up AI in this case of 78% CKD stage 4. AI Kidney Guardian recommended SGLT2 and ACE inhibitor, not a doctor, but it is the app which predicted, and the EGFR stabilized within a year's time because of these interventions relevant to that patient. And the Niramai, which is being used in the South India, Nephro AI gave a personalized diet and exercise care and moved the whole patient's scenario in a very different format. Am I talking through my hat, or am I just doing a commercial business telling you what AI tools are? I'm not talking through my hat. I'm showing you a couple of papers here which are literally filling up the literature space. There are lots and tons of paper coming up telling you huge amounts of work being done through AI algorithms, which I call as healing algorithms, and managing kidney disease, managing cardiac disease, managing retinal diseases and type 2 diabetes, and not only preventing it, but more important, guiding the patient who's already got it to prevent second episodes and take care of it in a much better way. Neuropathy is another place. Picking up foot ulcers when you cannot clinically visualize them is another place. Managing electrocardiogram, I'm not showing the slide here, I'll tell you in short about my own case. My own patient with a sugar of 200 and 320. A Gujarati patient came to me, 40-year-old gentleman, put him on anti-diabetics, did well, got his sugars under control. Somebody influenced him to tell him, which you all will resonate with me on that allopathic medicines are not good for health. Shift to Ayurveda. He shifted to Ayurvedic medicine, disappeared from my clinic for 4 months. I have a marketing team which follows on them. He said, we don't want Dr. Modi's treatment because we are very happy with Ayurvedic treatment. Got little nausea, vomiting, so he thought कि कफ पित्त वात बढ़ गया है. Went to the Ayurvedic doctor who could not help him. Went to 3 cardiologists who told him this is an MI, which didn't go down his gullet because he thought they will ask for an angio, and they did ask for an angio. Unfortunately, sugars were 320 and 450, so he came back to me that this gentleman got the initial control of sugar, so he will take care of it. I just did a Tropi, which was some 78 or something quantitative. I told him you need to be admitted. Had a little fight with the patient's wife who said, why are you admitting him? Anyway, got convinced, got admitted. Right coronary 100% block, left coronary 70% block main, and obtuse marginal some 30% block. Got 2 stents in place, recovered. Touching my feet has given a very good Google review. The bottom line is for 3 days ECGs were bang normal. I showed him in ChatGPT because we do not have commercial tools in India. It diagnosed and picked up non-STMI. That convinced him and he got admitted. So that is my own example in real life of picking up non-STMI, and there are enough cases of non-STMI being picked up by AI and not by cardiologists who are really senior, well established. Gestational diabetes, there is no tool as yet in the market which will help taking care of infertility, precious pregnancies and gestational diabetes. But TIR, when you combine it with an AI tool, the outputs are mind-boggling. My own 3 patients have conceived after failure of 3 pregnancies. Unfortunately, the credit was given to the IVF specialist and not to me. But trust me, the TIR was maintained to 97% in the last 6 months that they came to me. So anyway, now I want to show you something which is a mind-boggling tool. One of our own colleagues, Dr. Bharat Sabu, is not here right now, but he's very much there in the conference. He got the prize from ADA, and let me show you real life how Mitra works. So this is a real life example of, just listen to this.
Mitra, मुझे pre-diabetes है, तो मैं diabetes का पेशेंट न बनूं, इसके लिए मुझे क्या करना चाहिए? जरा मुझे प्लीज गाइड करेंगे आप?
So here you are getting the guidance in Hindi language, and this is taking care of it, guiding him absolutely accurately and promptly in a very nice manner. And you can start using it right now in the next 1 hour. If you want to load Mitra on your mobile and in your own AI platform, you can actually tell your patients how to take advantage of it. Now this patient, I don't know what answers he gave. I don't understand Malayalam. You can help me. Just look at the answer and tell me whether Mitra is right or wrong. Is that okay? Anybody from the audience, is it right? Okay.
Mitra, can you tell me all this information given in Spanish and Latin also and Bengali also? Thank you.
So can you imagine how you can handle your international patients, your regional patients, your own ethnicity patients, different kind of patients. You can ask about diet, you can give you a prescription, ask the patient to follow the diet and the prescription and guide the patient how to follow that prescription. If you develop UTI with SGLT2, how to prevent UTI, how to manage it, all that is possible through this AI tool, which is very much approved by ADA and is working. So hypoglycemia, cardiovascular safety, renal profile, all those are big problems in diabetics. What studies have shown is there is a 3 times better outcome when you overlay AI than without AI. Now, if you look at the cost factor, you see the traditional care, the prediction accuracy is 65% with AI enhanced. Not only AI, but AI enhanced, it is 94%, means there is a 45% improvement. Complication detection, which takes 12 months in a traditional clinical method, takes 48 hours to 12 hours in an AI system. The annual cost, which works out in the Indian population, which is 35,000 in a clinical scenario, works to around 22,000 with an AI system. So the quality of life, which is finally what is more important, shoots up by 37%. So what is important is selecting the right tool, monitoring the tool, adapting it to your ethnicity and your clinic. absolutely personalized, not only to the patient, to the doctor, review that, and Dr. Amit will tell you, generate data and publish papers and show to the world what you can do. We have enough Indian ecosystems ready which you can start using for your clinical decision support, and you can actually take these benefits back home to your clinic right tonight and tomorrow and start using it and see for yourself how does it make a difference to your patient's life. I'm using it, I'm getting enough benefits out of it, and this is very much possible. You can prevent morbidity and mortality in your patient because of AI, and you can take care of every aspect of diabetes because of AI. Gestational, neuropathy, nephropathy, cardiac, whatever, and trust me, use it and see, it is not at all costly. The moral of the talk today is call to action. Are you ready to join the AI bandwagon? Are you ready to support AI? And are you ready to see the benefit on your own life? Why don't you try it out on yourself and your patient? Just one work. We have Doctors AI and Amit is here, the founder chair. We have Doc Yantra. These are some of the AI tools, companies that we have launched. We are working very hard on developing AI solutions. We have been incubated by NASCOM. We have been incubated by the Government of India. We are working on it. We are getting approvals. These are some of the QR codes which you can download and take it. We have fantastic technology and AI discussions over here. A lot of people teach me AI because of this, and I'm very grateful to some of the members who are present here who have contributed, who learn in a big way. Amit will tell you about the beautiful college they've launched on AI. It's a fantastic college and you all should be part of it. AI is a big revolution that we should look for and take it forward. And before I conclude, special thanks to Jyoti sir, Sunita ma'am and Dr. Gopika for giving me, this is my first time I've come to JPEF. So since Guru Purnima has gone yesterday, I would like to humbly say thanks to them for giving me this opportunity. Thank you very much for tolerating me for 15 minutes, and I hope you will be able to tolerate AI and make your lives better. I use AI to file my tax returns, tell me share markets, and help me when my wife shouts at me, gives me very good ideas to take care of her. So thank you very much once again.
Thank you very much, sir. That was a wonderful presentation.